So the International League Against Epilepsy actually revised their classification system a few years ago. And so, we no longer use terms like partial seizures or generalized seizures, and we really refer to seizures more in terms of networks. So if the seizures start in a specific area or they involve so-called focal networks, they're called focal onset seizures. If they involve networks on both sides of the brain, they're considered to be generalized onset. And if we're not sure whether it's a focal network or a generalized network, then we use the term unknown onset. Now, to subcategorize them, if a person loses awareness during a seizure, that would be a focal seizure with loss of awareness, or a focal unaware seizure. And if they don't lose awareness, then would be a focal onset seizure without loss of awareness. Similarly, if they have motor symptoms during the seizure where they have motor movements and so on, then it would be a focal onset seizure with motor symptoms. And the same thing with generalized seizures where the generalized onset could be generalized onset could be generalized with motor symptoms or without motor symptoms. So there has been a shift in terms of how we refer to these seizures or classify these seizures based on the new ILAE classification system. Yeah, sure. So, when we talk about treatment for patients, the goal is always seizure freedom. And we would classify and we would define seizure freedom as having no seizures. Now, one of the issues with that is obviously we can only really go by what the patients report. So if the patients tell us that they're seizure free, then we would consider that to be seizure freedom. Now, in terms of the goals to achieve seizure freedom, obviously that's the goal with all our patients. Sometimes we're unable to achieve that goal, because obviously if somebody has tried or failed several different medications, it may be very difficult to achieve that goal. But even in those circumstances, our goal of treatment, if we can't achieve seizure freedom, would be to minimize side effects, would be to have a patient on uh, as little medication as possible or as few medications as possible, because all of those factors are going to impact that patient's quality of life, whether they're still having seizures or whether they have significant side effects related to the medications that we're giving them. So, and we want the patients to be seizure free. That's always the goal. But if we can't achieve that, we want to try to give them the best quality of life possible by minimizing side effect profiles.